Ethan, thanks so much for spending some time with us today and talking through this important issue.
Thanks for having me.
So we've noticed and we've talked a lot, especially in the Twin Cities, the Heart Association and the medical community have this concern about people not calling 911 and going to the emergency room with a time-critical condition like a heart attack or a stroke. And now we're seeing that there's even health disparities within that particular problem. A new data from a Harris Poll survey found that half of Hispanics and almost half of Black Americans say they'd be too scared to go to the hospital if they were having symptoms of a stroke or a heart attack because they'd be afraid of getting infected with COVID-19. Why does this fear exist and what can we do about it?
That's a very important problem, and we are certainly concerned about it. We did see a drop in our volume, number of patients who come to the ED and the number of strokes we see compared to last year. And I think people are, rightfully, of course, they hear a lot day and night on the social media and TV and all media outlets about the danger of being infected with COVID-19, and they don't hear the other message though. And I think that's important, that we try to achieve some balance in the message. That yes, of course, COVID-19 is a dangerous disease and it's infectious, but there are other diseases that are also important and dangerous and can be life-threatening and or cause disability that we should not ignore. And I just feel that this other message is not getting across as strong as the main point about COVID.
Right. And the pandemic hasn't slowed down the number of heart attacks and strokes happening, and still people aren't coming into the ER. So can you help us explain a little bit, why is time so critical in those conditions?
Right. And stroke happens when there is a blockage of an artery taking the blood to the brain. Heart attack happens when there is a blockage in an artery of the heart taking the blood to the heart muscle. And every second, there is no blood flow going to that part of the brain or the heart. There is cell loss, there is damage to the tissue. And so we always say time is brain, or time is heart. So we don't really have too much time, and it isn't that we can wait an hour, and if things don't get better after an hour, then maybe we think about going to the hospital. Once someone feels or suspects, not even sure, just a suspicion is good enough. Once someone suspects there are symptoms of stroke or heart attack in her or him or someone they know, they should call 911 and come to the emergency room immediately and not have to worry so much about COVID.
Yeah, so important and so time critical. People being afraid of being exposed to COVID, I don't think we do a good enough job explaining how safe hospitals are. Can you talk a little bit about protocols and safeguards that hospitals are taking to keep patients safe in the ER?
Absolutely. Actually, it starts with the emergency medical services, the ambulance that comes to the person's home. The crew have to be evaluated, screened every day. And anyone with symptoms or has a family member with symptoms concerning for COVID, they go home. They don't come to work and take care of people. In the hospital, the emergency rooms have been divided. So part of the ER is for those with known COVID or who screen positive for COVID, and the other part isn't. The visitors are limited. The PPEs, the personal protective equipment, is available, and there are certain requirements before anyone can go see a patient. The doctors and the nurses and all the staff who work in the hospital, they are screened every morning. And again, if someone is having symptoms concerning or has a family member who has symptoms, they don't come to work. They're not allowed into the building. We spend a lot of time making sure that our patients are safe. And we want to reassure the public that coming to the hospital for any medical issue is not that big of a deal. Especially if you have a medical emergency that is life-threatening.
Right. That is so important that people know that hospitals are safe. And particularly if you're in one of those situations, calling 911, getting EMS on the scene, and getting to emergency room is so important. And you're absolutely safe doing those things. We knew during the pandemic and even before the pandemic that time critical conditions like stroke and MI affect communities of color disproportionately to our white communities. But now we know that COVID-19 is also nationwide affecting communities of color disproportionately. Why is that?
It is unfortunate, really, but the social and the economic reality put the minorities in disadvantage. Access to regular doctors for routine care, having conditions like diabetes and high blood pressure and heart disease and lung disease under control. It requires having a primary doctor and having regular visits and regular tests and being on medications and being in a kind of a steady medical care. And that is not easy, to accomplish for the minority population compared to the rest. And so we are already starting off in a disadvantage. And now COVID-19 pandemic comes and hits the already disadvantaged group more. Having the housing environment that allow for good ventilation, how dense the neighborhood is, or having the ability to shop by online and having food delivered or these things, and avoiding the exposure, having available masks, especially at the beginning of the pandemic, was not equally available for everybody. So the pandemic hit the minorities harder, who are already advantaged and have medical conditions that would put them at risk uh, even before the pandemic. It's unfortunate, of course, but it is a reality, and we have to realize that this is happening so that we can address it.
Yeah, we've been really trying to point out that COVID-19 didn't cause any of these disparities. They just exacerbated disparities that already existed in our society and in our medical system. So before we go, what advice would you give to someone who was feeling like they had symptoms that they might think about calling 911, but they're a little nervous about COVID exposure for them or their loved ones? What would you tell them?
Hospitals are safe. We do spend a lot of time to make sure that the hospitals are safe for COVID and non-COVID patients. Don't make your fear of catching COVID from going to the hospital prevent you from addressing a medical emergency that you are having now. Catching COVID is a possibility that may or may not happen, and we spend a lot of time to prevent it. But having a stroke or having a heart attack is something that you are having right now, and you have to address it.
That's such an important topic. And as we say around the Heart Association, don't die of doubt. If you're concerned, call 911.
Exactly.
Itham, thanks so much for spending some time with us today and helping us get this message out.
Thank you, Justin. You have a nice day.
You too.